Receding gums can be unattractive and actually lead to tooth loss, but too many of us may think gum grafting surgery is just too invasive.
But a Los Angeles dentist developed Chao Pinhole Gum Rejuvenation, a minimally invasive technique to correct this problem. We have Dr. Bruce Crawford of St. Petersburg. He is a certified provider of the pinhole procedure, and you join us now. Thanks for being here.
Thanks for having me.
We really appreciate it. We were talking before we came back from commercial break, and a lot of people, you know, obviously you have the aesthetic aspect of this,
Yes.
but a lot of people also are concerned about their health, right? Are you
Yes.
seeing that?
Yes.
Seeing both?
Yes, both. So the aesthetic part, I like to think about the gums as kind of framing the teeth. And so we notice that when the gums recede, the teeth look longer. And you've heard that saying, getting long in the tooth. And we associate that, of course, with aging. So people will say, you know, I'm embarrassed to smile, I've lost confidence, and things like that. But as you said, a lot of patients are concerned about health because as the gums recede, they're losing bone. And the bone's the foundation which is holding their teeth in place.
Yeah, I didn't realize that. How is this different, this new pinhole surgery, different
Yes.
from conventional gum grafting?
So the conventional technique is we harvest tissue from the roof of the mouth, and then we make an incision and flap the gum tissue back and place that harvested tissue over it. Whereas the pinhole, we're making tiny little openings just above the receded gum, and we use microsurgical instruments to pull the gum down. So the major difference is you get the instant result that you're seeing there on the screen. It's immediate, and the patients are amazed because with the conventional type, it works very well too, but it takes much longer to heal and many more appointments.
Wow, it's so fascinating. How did you find out about this procedure, this technique?
Sure.
And why did you want to start offering it?
Well, I'm always looking at something that can help my patients, and it seems like, you know, everybody is looking for something that's minimally invasive. So I heard about the procedure. I went out to California. I was actually one of the first people on the west coast of Florida to be doing the procedure. So we've been doing it for about 7 years. And I decided to do it because, as I was saying to you all earlier, I like to say the Amazon generation we're in now. Everybody wants everything now or, you know, the same day. And so we're able to correct a patient's entire mouth in one visit, where we can't do that with the conventional. So it just made sense to me, like I need to offer this, and it's minimally invasive.
That's pretty amazing. Can you describe what the entire patient experience is like, and like you said, how long it takes, what people can expect?
Sure. So the patient's experience is they're going to be anesthetized just like any other procedure that we would do. And then we make a tiny little pinholes above where the area is receded. We use the microsurgical instruments. We bring the gum tissue down, and then through the tiny little openings, we place collagen. So there are no scalpels, there are no sutures. With our conventional technique, we have to use those. And so they get that instant result like you're seeing, the before and afters. That's how they leave. It's like that immediately. The holes seal up on, I know, it's amazing. The holes seal up on their own.
I know this is a game changer for so many people. What have you heard from your patients who've gone through this procedure?
So that's been the amazing thing, because I've been practicing for almost 30 years. And so I have patients that have rejected having the conventional technique done because either they've heard from a neighbor or somebody who's had it done, oh, you don't want to do that. They take tissue from the roof of your mouth. So this eliminates all of that. It puts their mind at ease, like they can do this, and there are so many fewer appointments. They get the result immediately, which we all would like that, right, for everything.
Where can viewers learn more information about this?
So they can go online and look at askyourdentistpinhole.com, and I believe there's a phone number as well that y'all are providing. There we go.
626-308-9104. Dr. Crawford, thank you so much.
Oh, thank you guys. I appreciate you having me.
Absolutely.
Thank you.
We'll be right back.